Hi YouTube. Um, Today I wanted to talk to you guys about weed or marijuana. We gotta be politically correct around here. Um, I've been thinking about this, and I've talked about this for a lot of years. Not with you all, obviously, but a lot of years with people that deal with me on a daily basis. Um, and the things that we do to our bodies that we aren't supposed to do, being that we do have sickle cell. Now, I smoke weed, marijuana. I'm sorry. I smoke, and my smoking, I've been smoking for a lot of years. A very, man, at least 20 years I've been smoking. But I started off smoking for um, personal reasons. I'm a kid, just want to get high, try something new. But as I got older and my sickle cell started to get worse, I started noticing that my smoking actually helped certain pains. Now, it doesn't help all the pain. It helps some pains, like certain back pains. It'll help. I get a lot of crises in my lower back. That helps when I smoke. Um, Certain leg pains, certain arm pains helps. Now, if I'm in just a flat out severe crisis, it's not going to do anything. But like for the mild achiness, the bothersome pains, it actually helps. My doctors don't fuss at me, don't bother with me. They know I smoke. I've never lied about it. I've never denied it because of the fact that they draw our blood so much that I wouldn't lie about something like that. That'll put me in a bad position. But I prefer to smoke over taking the pills. I went to the doctor Friday to get my refill on my medicines. Now, I've seen some people really don't like saying what they take. Me, I really don't have a problem saying what it is that I take because that's still all a part of um, the sickle cell and how I maintain my pain or how I control it. And so I don't have a problem talking about the pills that I take. I'm only down to two major pills, pain pills. I take morphine. I take 90 milligrams of morphine twice a day, and I take Tylenol 4 for breakthrough. Two pills every time. I take every day. First thing when I wake up and before I go to bed. Um, I do have pain on a regular basis. There's not a day that I wake up without some type of pain, whether it be big or small. In the hospital, they do this thing called the scale, 1 to 10 scale, 10 being the worst, 1 being the least. On a daily basis, I have at least pain on a scale of 1 to 10 at a 2 every day. Now, that's just my normal. I'm moving, I'm used to that pain, I'm used to the achiness, I'm used to that, so that doesn't bother me. That's where the Tylenol comes in at. But when I don't take my medicine, it becomes worse, obviously. It's to the point where I know that I think I'm physically addicted to the pills because I have to take them so much. And I've been on narcotics since I was a baby. I was diagnosed at like 4 or 5 months, I believe it was. So I've literally been on narcotics my entire life. Um, I hate taking the pills. I mean, you got the regular pills that I take, folic acid, the blood thinners. I used to take hydroxyurea, but with my veins being so bad and me being hospitalized so much, you have to get your blood drawn on a regular basis with hydroxyurea, and I couldn't do it. They can't. My veins are bad. They can't get the blood that they need, so I had to come off the hydroxyurea. And when I got pregnant, I couldn't take it either. So it was a few reasons why I ended up not being on the hydroxyurea. But the regular everyday pills, it's a fight, but I take them. Pain pills, I hate taking the pain pills because it still makes you tired and you have to sleep it off. Having kids in my house and being in the house all day, I can't sleep anything off. So taking it, I'm just overly tired, overly, overly tired. So I just stopped taking them. But then when I stop taking them, I become sick. So it's really a bad, vicious cycle, really irritating. So I smoke. As you see, I am thin. I am so thin. It's ridiculous. I'm 31 and people actually talk about me because I'm so little. Look at that. Look at that. You can see my little bones in my neck. I'm really thin. I'm only on a good day. I'm 100 and something pounds. But right now, I'm only 105 pounds. 4 points, 104 point something something. So we just gonna say 105. But I'm usually very small and I don't carry an appetite. So smoking helps me eat. Smoking makes me feel better and relaxed. Not being able to take the medicine or not wanting to take the pills and the stress of the day. I can smoke and it will help certain things. Now, when I went to the doctor, my doctor did tell me that um, they've never bothered with me about my smoking, but it could become a problem down the line because I do take narcotics and my drug tests do show that I smoke. I'm drug tested regularly. I don't care. I don't take anything. My pills are always in my system. I don't sell my medicine. I don't get rid of my medicine because I need my medicine. But they do drug test me to make sure my medicine is in my system. And of course, they check for the marijuana and make sure I'm not smoking anything else, which I would never do. I don't even drink like that because a hangover for a normal person, my hangover is a crisis. So I can go get pissy drunk tonight and be in a full blown crisis tomorrow morning. So I don't drink. I drink in moderation, really, really small, if I do drink anything at all. But I do. I smoke, and the doctor told me that it could be a problem. So, excuse me. I'm in the process of getting ready to move when my daughter gets out the eighth grade, and that's one of our things we were moving. One of the thoughts that we had was going to be about my medicine and my smoking. And that's really weird that it's that involved in my life that we have to, what's the word I'm looking for? We have to prepare ourselves. That's still not the word I'm looking for, but we have to prepare ourselves for a new environment and the way that this new environment will work. And my doctor did tell me that I should find some place that would be okay with me smoking and having to take the narcotics. So then you get to the miracle marijuana, and I think that we're going to end up moving someplace where they do have um, the medical marijuana because I don't think I stopped smoking because it truly helps me. I don't know how many of you all out there are depressed, but ever since I could remember as a child, I've been depressed, and I know that they said that has a lot to do with having a major illness. So that helps. My smoking helps a lot of things in my life, and I don't use it to fall back on, but it's a part of what I do. It's a part of my life, and it relaxes me and it makes me feel better pain wise sometimes. And I keep stressing that sometimes because I don't want anybody to think that I'm just a weed smoker because I can use that and say that it makes the pain feel better. It doesn't. It only helps some of the pain. I don't know if any of you all out there smoke. I would like to hear your opinions on this because I would like to know if it helps anyone else. Has anyone else ever thought about the medical marijuana? Has anyone else actually figured that smoking helps? I hate the pills. I don't like the pills, and I would prefer to smoke rather than take the narcotics, knowing that somewhere in me I am addicted to them. Mentally, I'm not. Physically, I am. Because mentally, I can not take them. I don't take them. And I get in trouble for not taking them. But when I don't take them, I'm not sure if the pain gets worse or not. But it's really hard. It's so many things that go along with having sickle cell. And I know you guys know that. Those who are carrying this wonderful disease of ours know, sometimes something makes it feel better, sometimes it doesn't. I did the transfusion therapy. I haven't been on transfusion therapy in a lot of years because the last time I did therapy, I had a reaction. So that was a dumb one. But it's other ways to make us feel better or to kind of mask the pain. And to me, smoking is one of them. So if anyone's out there paying attention, listening, watching, kind of let me know if this is something that you thought about. Is it something that you've done? Is it something that you do? I'm curious, and this is why I'm here. So I will talk to you guys again real soon. Deuces.